and thanks again so much for being with us today. Let's get started. So, in 1969, Governor Reagan signed the Lanterman Act, creating a cradle to grave entitlement for people with developmental and intellectual disabilities, now serving roughly 500,000 Californians at a cost of about $20 billion a year. There is no equivalent entitlement for people with severe mental illness. Do you believe California should create such an entitlement for serious mental illness? And if so, what specific revenue or budget trade-offs would you use to pay for it?
Well, first of all, thank you for having me on. Let me just say this. The Lanterman Act was a great piece of legislation, but it should have included mental health and behavioral health. It didn't. I've been arguing that we need a lot more money for mental health parity. I supported the MCO tax because I believe that one of the reasons we don't have enough mental health professionals is because we don't have mental health parity. Where would we get the money? Well, as you know, we had two propositions for mental health um, and behavioral health. I think one was by Steinberg, and I don't recall who was the author of the other one. There's state monies that we have to invest here with respect to mental and behavioral health. But as I said, you could have all the money in the world, and if you don't have the mental health professionals, you don't have the appropriate reimbursement rate for mental health as you do for physical health, we're going to continue to go through this crisis. And right now, let's be clear, since COVID, we're social animals. We live in communities. People are alone. And you've seen a mental health crisis of, you know, enormous proportions, not just here in California, but around the country. And particularly with young people. Young people currently, it's a public health crisis when it's the number one killer of young people right now. So I think we have mechanisms in state to do this, but we've got to do it with intention. And the problem with Sacramento right now, we create a lot of laws, we set a lot of goals, and then we don't work on meeting them. The next governor's got to work on meeting them. And I will. I have a record of doing that, both as mayor and as speaker.
Yeah, to follow up on that, the current governor has invested over $16 billion towards behavioral health transformation. What is one major structural outcome that you believe must be in place at the end of your first term for those investments to be considered a success? And how would you measure progress toward that outcome?
Well, I think you just said it. We have to measure progress. One of the things I did was had dashboards across the board, dashboards for housing, for affordable housing, for market rate, for homeless housing. I actually built more homeless housing in 8 years than the 12 years before that. And 4 of those years, I was in a recession, really tightening the belt. So I think the goal has to be that we have to increase the number of mental health professionals, that we have to make sure, as an example, the care courts, which I supported, are actually working. Currently, they're not. I know with the initiative that was passed, I think in 2025 or 2024, we were supposed to build 10 projects. None of them are off the ground right now. So projects like that need to be on a dashboard with people and metrics associated with them. That's how you get to goal. And that's what I'll do. A chief executive, and when you're mayor of LA, I was speaker of the assembly, as you know, and I balanced two budgets with a surplus, with a Republican governor and a Democratic one. But when you're been mayor, of LA, that's the job closest to being a chief executive. And what I understood, the council passed the laws. I had to implement them. And that's what the governor's office has got to focus on, and the agency's got to focus on. Let's start driving results on care courts, on housing, on services that work. I believe that that is what job number one for the next governor is.
You mentioned care courts not working. How would you fix it?
Look, I think we got to hold counties accountable. Let's be, eh, they were supposed to implement them. It's been a very spotty record throughout the state. Virtually no county is really exemplary in terms of fulfilling that mission. There are a couple I've heard, but most of them aren't. And what you do when you're governor is you say, you won't get money. You will be held accountable if you don't start the implementation process. You mentioned Ronald Reagan. You know, Sacramento loves to talk about, Marissa, that Ronald Reagan got rid of mental health units, mental health hospitals and the like. Well, we've been in office for 28 years. Why haven't we opened them? We need locked mental institutions for people. That's what the care courts provide us an opportunity to do. There are people who are a threat to themselves and others whose family members want to commit them because they don't want them on the street. That's not compassionate. They want them getting the care, the services they need, Marissa. But if we're not utilizing those care courts to be able to do that, if we're not building the locked facilities, then what you have on the streets is chaos. I've made it really clear, Marissa, I'm not for criminalizing homeless. I am for compassion, but I'm not for chaos. I've seen as I go up and down the state, people are calling for draconian responses uh, to homelessness, which I don't support. But I'll tell you something, people will stop to support them. And what is chaos? Selling drugs in front of cops, defecating on the street uh, when there's an outhouse right next to where you're at. Encampments in front of schools and parks. We know what neighborhoods they'll be in. People find that is chaotic. So the next governor's got to hold the line on care courts, on projects that have been funded, that need to be built, on the mental health parity issue, on the career technical, education so that we're getting those mental health professionals working with community colleges, the CSUs, the UCs, for the workforce development. Right now, people don't want to get in that profession because there aren't enough jobs, even though there's a big need. And when there are jobs, they're not getting paid what they need to get paid to be able to survive.
Mhm.
That's why
Thank you for that.
affordability is a big challenge facing us in this state and a challenge that I've spoken to and have a plan to address.
Yeah, thank you for that. And we'll return to mental health funding, but let's also talk a little bit about homelessness. So for the next question, California still has the largest homeless population in the country. But 2025 saw a 9% drop in unsheltered homelessness, which broke a 15-year trend of growth and suggests that housing first and supportive services may be starting to work. What do you see as the core drivers of homelessness in California? And what would you prioritize to keep unsheltered homelessness declining?
I think the high cost of housing and rent is driving a, a lot of the homeless problem or challenge in this state. I think you said the state has done a lot, but we spent $24 billion on homelessness, and homelessness went up during that period. The LAO did a study. They could only determine that two programs out of the dozens of programs that were being funded actually work: rental assistance and Home Key, which I think down here in LA they call Inside Safe, which is, temporary housing. The average unit costs $850,000. That's not sustainable. In Santa Monica, it was $1.2 million. Tiny homes, and I just visited city of uh, the Hope Mission, rather, in the San Fernando Valley, the largest provider of homeless housing in the state. They're in Bakersfield, Fresno, San Diego, and Los Angeles. And they're building tiny homes for 30 and 40,000, and they say that we can build them for 100,000. But instead, we're focusing on things that aren't sustainable. And $850,000 units are not sustainable when you repeat that on the street. So I think housing is definitely the first and most important issue. But we have a drug problem in this state on the streets of California. We have a mental health crisis, a behavioral health crisis. And that's why care courts are important. And that's why providing the support for these people is essential, the permanent supportive services. I mentioned I did more housing in 8 years than the 12 years before me. We had a fraction of the homeless that we have today, but we paired it with the county who provided the permanent supportive housing. But now, even back then, we didn't realize there are opportunities like tiny homes that we can invest in that we also have to look at.
Mhm. Thank you. And to follow up on that, many mayors are calling for the Homeless Housing Assistance and Prevention, or HAP, funding to be ongoing and guaranteed. Do you support locking in ongoing state homelessness funding for local governments? And if so, what performance or accountability conditions would you attach?
You said it. The answer is yes, but only if there's accountability. The only way we can move away from a $24 billion expenditure on the part of the state that saw, well, during that period, no progress. It actually went in the other direction. There has been some progress in some cities, including my city, under Mayor Bass. But we need to see um, broader and deeper progress throughout the state. And so, yes, I will set accountability uh, metrics on each city and county. We will work with them and collaborate with them. I've been a mayor and I've been a speaker. So I'm the only one with that kind of experience. I balance both the city budget and a state budget. So I know this, you can't throw money at programs that don't work. And so far, the LAO, I'm not saying it, the LAO has said it. We spent a lot of money and we don't know where it went. There could be fraud and abuse. We don't know where it went, but we know this, it didn't work. So yes, more housing, yes, more services for permanent supportive services for mentally ill and drug rehab. But yes, those programs, there's got to be accountability to make sure they work. So it won't just be money. There will be metrics and results at the end of the rainbow, or there won't be money.
Thank you. And let's talk more about something else you mentioned earlier, which is involuntary treatment. While many Californians are frustrated by visible encampments and public disorder caused by people who are too sick to voluntarily accept help, some civil liberties groups warn that expanding civil commitment and court-ordered treatment approaches such as care court risks coercing people with mental illness. Give two specific examples that illustrate where you personally draw the line between an individual's right to refuse treatment and the public's interest in safety and order, and explain any legal changes you would propose to move that line.
The reason why I supported the governor in the establishment of care courts, and I'm a former president of the ACLU of Southern California. I believe in civil liberties. I watched with horror One Flew Over the Cuckoo's Nest, where in the 1950s it was too easy to put people in a mental institution. Now it's virtually impossible, Marisa. And while I've heard from those advocates, and I agree with them, we've got to protect civil liberties, civil rights. We can't just commit people because they're acting out as an example, but where they're a threat to themselves and others, where they've engaged in violence, and particularly where family members have argued they need compassionate care. then we can't be afraid to make the tough calls. So I don't have two examples uh, per se, but I do know this. The notion that there's a slippery slope, the same people that say we shouldn't have care courts are the first to criticize Ronald Reagan for closing them, the locked mental institutions. You know that, I know that. When you're a governor, you're not looking for the perfect. You're looking for the good. What's good for most of us. What scares me about the chaos that we see and the public disorder is you're starting to see people say really draconian things about the homeless. And I'm not that guy. But there for the grace of God go so many of us. We're one paycheck from homelessness. So I believe in compassionate, but I think it is compassionate to commit people who are a threat to themselves and others, who are clearly mentally uh, ill, to those locked institutions. Now, they we won't do it like they did in the 1950s, but this notion of slippery slope, while a slippery slope is something you always got to care against, you can't use that as an excuse for doing nothing. And too many of those people want to do nothing.
Mhm.
I'm
Let's
a
dig.
con when I say I'm for compassion, not chaos, I'm for common sense, not chaos.
Hmm. Yeah, let's dig a little bit more deeply into that. Like you mentioned, the current involuntary commitment standards rely on the quote unquote danger to self or others, or being quote unquote gravely disabled. And like you said, many families and providers say these thresholds are both too vague and too high. How would you change that legal standard?
Well, I'd work with, therapists, experts in the field, with a broad cross section of stakeholders, but people who want to look at the science and not the emotion, who understand that you can set uh, standards that work. They won't be perfect again, but they work. They work better than what we have right now. Right now, as you said, those standards are too broad. But we're intelligent people. If we can send somebody to the moon, we could figure that out. And not everybody will agree with those standards for sure, but we'll have standards. So I won't hide behind the notion uh, that they're not perfect. What we want is things that work for more people than are currently being served. So I do believe we need locked mental facilities. I think they should be more community focused. They should have compassionate care and quality therapy associated with them. But I don't believe that people have, as some do, that, because it's hard to come up with a standard that we shouldn't try, and that we shouldn't have a standard. Why is it, Marisa, that you go around the world, and I know you've traveled to other places, you go around the world and you don't see the number of homeless you see here? And they're democratic countries that, are compassionate, that follow the science. We can do that too. But that's leadership. If you're looking to be the most popular person, if you're looking for everyone to love you, um, I like dogs. I say, go get a dog. These are jobs where you got to make tough calls. These are jobs where you got to say, we've got a big problem here. We've got to work together to solve it. But I intend to work with the science, with the experts who can, help us come up with the right mix of programs, the right standards. Uh, but I know this, there are too many mentally ill people who are a threat to themselves and others on the streets of California cities.
We
You've seen
have
it, and I've seen it. If you write enough articles, you've seen it.
Yeah, absolutely. We have about 1 minute left, so just quickly, I'll ask one more question. The Medi-Cal system is a key safety net for people who are poor and at risk of homelessness. Right now, Medi-Cal patients often get primary care in one place, mental health care in another, and substance use treatment in a third, with county carve-outs creating constant handoffs and gaps. What specific structural reforms will you commit to in your first term to end or significantly shrink this fragmentation? And who should ultimately be accountable for a person's care across these systems?
I think for the unhoused, it has to be counties, and it has to be one stop, a place where they can deal with all three issues, where they're working together. The providers are working together and know the specific situation in all three of those buckets or those areas. I think that's how you do it. That's how I've done it in the past. When we were building permanent supportive housing, you bring the different agencies that approve them all in one place.
Gotcha. Well, that's all we have time for. Thank you so much for joining us.
Marisa, thank you. And I've read some of your articles. Really appreciate your work.
Well, thanks so much.